Hi, I'm Gail Springer, the Mental Health Clinical Nurse Specialist, and today we're going to be talking about restraint use here at Providence Hospital. We're working on changing our culture so the focus is on how to prevent or limit restraint use through the use of alternatives, early intervention, and de-escalation techniques to help ensure patient safety. Restraint alternatives include such things as distraction, de-escalation techniques, fall alarms, floor cushions, soft music, regular exercise and activity. Here at Providence, we limit restraint use to emergencies when there is imminent risk of the patient harming themselves, others, or staff. Restraint use is inherently risky, and reports of Joint Commission have shown numerous deaths while in a restraint. So that's why we're very careful that we use the restraint at very last resort, and when we use it for the shortest amount of time, and we use the least restrictive one. When we initiate the restraint, we want to make sure we're talking very gently to the patient, assuring them and reassuring them of their safety, and that we will keep this to the shortest amount of time. I am now demonstrating the soft limb restraint that we use for patients who are pulling at tubes, drains, and lines, or picking at wounds that we want to protect. It is to prevent them from interfering with treatment. We put the soft limb restraint around the wrist like so, bring it around like that, and Velcro it on. We put the snap clip on the inside of the wrist around the thumb. We check it and make sure you can fit one finger underneath. The strap goes on the outside, the ulnar side. And what we have with this is called triangulation, which either allows movement or decreases movement. So if we have one point, they have a lot more movement. If we have 2 points like this, we have very minimal amount of movement. And we also have quick release restraints here. So what you do is you hook it to this piece to the bed like this and bring it through, and then you hook the restraint strap to it. You snug it down. And I have found that it's okay to put a little loop here and tie a knot here, because sometimes patients can get these hooked and they can slip. It's still a quick release restraint, but with this knot, it keeps it from slipping. And then we would hook this to a lower portion of the bed right here. And make sure that you attach it to the movable portion of the bed that moves up and down with the patient when they're moving. And then you also want to always make sure that the call button is within reach. Let's go ahead and demonstrate the soft limb restraint. You take the restraint and you put it around the wrist, and you bring this piece around and down and take the Velcro over here and secure it. And then you take the snap clip and clip it right like that, and that stays on the thumb side, and you snug that down. You want to make sure that a finger can fit underneath, and then the strap comes to the ulnar side right here. And then the straps that we have are triangulation, so they either limit movement or give you movement. So if we have 1 point, we have a lot of movement. If we have 2 points for it, we have much less movement.